Okay, so welcome to our podcast channel, You Can Be the Change. And today we are talking about physical health. And for that, I have with me Kinjal, who is a practicing physiotherapist. She did agree to grace this our podcast channel to talk about physiotherapy, the importance of physiotherapy, and what we should practice, in general for our physical health. So thank you so much, Kinjal, for joining us and just helping us know what really the physical health is and how important it is in today's lifestyle. So thank you so much. And I know that you've been practicing physiotherapy for now 7+ years, right? And you're based out of India, especially Gujarat, and that's where you're practicing it today. So thank you so much for joining our podcast channel. And of course, we would be looking forward to hearing a lot from you about not just the physical health, but what we should be practicing every day, so that I mean, I would not say not go to the physiotherapist, but if we can do things which we should be doing, practicing, which makes your job easier as well, for that matter, right? So thank you so much. And if you can just talk, I'm not sure if I've done justice enough in introducing yourself, but if you can just let us know about yourself a little more.
Thank you, Sugandha, for inviting me. I'm glad for doing this podcast, especially for on the field that I love. I love practicing my field. It's a very good job. Like initially, I never thought I'll be a physiotherapist. I always wanted to be a medical practitioner. But I don't know what happened. I entered in physio, and it's like, thank God I entered in physio. I am a physiotherapist now.
No, good. So good to know. Yeah.
Glad when patients come and say, like, it's awesome. You feel like, oh wow, you're doing a very good job when a patient appreciates your work.
Yeah, of course. Yeah, yeah. And rightly so, right? I mean, we go for our ailments to the doctor, right? I'm sure that physiotherapy now is becoming much more kind of known thing. But I know when growing up, physiotherapy wasn't something that people would take it very seriously. They'll be, it's paining, it will be okay. We'll do some stretching, it will be fine, or we'll take a pain medication, it will be fine. I think now there is much more understanding that it's not just a simple pain, and that simple pain can lead to something which is very, muscular, or kind of, at times it's like you might go to a surgery just because you did not take care of yourself, right? So yeah, I'm sure you might be getting such patients too.
Yes, I get patients. Like, there are times when they avoid the pain. Like they say, "Ki we had pains in 6 months."
Hmm.
I always say, "Ki if you would have come to me like 6 months before, you would have been treated like within 2 to 3 days.
Right.
But now the pain is 6 months old. Even I'll take that much time to treat it.
Right, of course, yeah.
To still avoid the pain in India. It's like still Indian people think, we'll do something gharelu upchar and it will get resolved.
Yeah.
But it is like if you come to a physio on time when the pain has started, things can be resolved much faster.
Right. Yeah. So I'm a little intrigued, Kinjal, and I would like to know about it more, right? I mean, you're rightly saying, right? One is key. You should know what the pain is all about, and if the pain is starting, you should come to a physiotherapist, and
Hmm.
the right at the time, instead of waiting, it'll ठीक हो जाएगा kind of stuff, right? So when and if you can just elaborate on it, what really, like, why physiotherapy, why I should come to a physiotherapist if I'm having a pain, or what should be my indicator that go to a physiotherapist and it's not just a simple muscular pain.
Not only pain, like if you have pain anywhere in the body, you should definitely go and consult a doctor. And if a doctor suggests you should go to a physio, you should definitely come. But not only pain, like morning mein if you're getting and if you feel that there's stiffness in my body, the
Uh-huh.
stiffness not necessarily means that once it is, then you might be have slept in a wrong position, you might get pain or stiffness. But if the stiffness persists, if you
Mhm.
think, yeah, it's been 2 weeks, 3 weeks, then there's something wrong with your muscle, with your body.
Mhm.
Get that indicator, resolve it, just talk to a physio, go and consult it.
Huh.
If there is a need, the physio will say, do physio. If there is no need, he'll say, do something at home, take a warm bath, it will be resolved. But these are the main indicators. If you have pain, pain is the basic and first indicator, but not only pain,
Okay.
stiffness, you might be having some dysfunction, like, no, I'm not able to move my joint completely.
Right.
During that movement, there's some issue or pain, or it's not going beyond a point. Your range of motion is reduced.
Right.
Even go and consult a physio. Just a small consultation might be
Oh.
a good for you.
Okay, okay. So it's not just the what is the general concept is key when it is a pain, then you should go
Ah,
to a physiotherapist. It's not just the pain, but it
pain.
is
Ah,
anything which is not functioning right in your body
correct.
because
Correct.
it's all mechanical. So once it's like if nothing is it's not functioning as it should be, it's
Ah,
the time you should be going to a physiotherapist and seeing and going there. So now tell
correct.
me one thing, Kinjal, right? I mean, it's and also one thing is key, the more you are aging, the more you need a physiotherapist. Is it right thought process or younger kids or anyone might need a physiotherapist for that matter?
Actually, today's generation, like, I can say today's time, everyone needs a physio.
Uh-huh.
Be it a young kid, like an infants also comes to us, infants, and even old age, like 60, 70 years, or even 80 years, adult also comes to us.
Right,
Nowadays, I can say the kids, the mobility has reduced because they are more on screen.
yeah, right,
Their,
right.
the activity has reduced a lot. So they get a lot of issue like neck pain because they're constantly on phone, not only because they are using studying and anything.
Right,
They have more screen time, so their eyes are becoming weak.
right,
They have started developing neck pain, and mostly people have started sitting in a hunchback position,
right,
loud.
right,
So these kids, like young kids, 15, 16 years kids, they come and they say we have back pain. I always say that you are not the age that you might be getting a back pain.
right, right.
This is the age of flexibility.
Yeah,
Back pain might start at after 30 because we get thoda stiff after 30. Our bones and joints and muscles start developing stiffness.
right,
So
right.
as and when we are aging, physio, not only physio, physical health or activity is important in your life.
Mhm. Uh-huh.
Go to a physio. If you're not going to a physio, get something active in your life. Like inculcate the physical activity, walking, jogging, anything which is possible for you.
Mhm,
Doing your 15 minutes yoga is also sufficient for you sometimes.
mhm, mhm,
Initiating is important. You might go to 30 minutes, 40 minutes.
mhm.
So it is important to start because kids are getting a lot of issues nowadays. They get heel pain, they get back pain, neck pain. The most common are neck and back pain.
Right, right,
And their muscles and joint, their spine is so stiff. I think okay, our spine is not that much stiff, but kids' spine are that stiff.
right, 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 right.
So it is important. And old age, so it is very much important because they have a very high risk of falling.
Mhm.
Their balance gets disordered. They might be dizzy sometimes, like crossing the road. They feel that they won't be able to cross the roads.
Right, right.
So
Yeah,
it is important. Like when we are going for physio, when they come to us, we teach them balance. We teach them how to cross the obstacle. Sometimes they don't even feel that there's a stone on the road or there's any obstacle. And
right,
they fall and they get fractures because at that age, bones are weak.
right, right, right.
So that can be avoided when they go to a physio.
Okay, yeah, very well said. Because I have aging parents, and I do see that this balance issues, and I've seen with my
Mhm.
friends' parents as well. Balance issue is very common, right? I mean that they just can't, they're falling often, or they can't stand, they can't walk as fast as they were. So you're saying
Hmm.
that it's not just that because you're not having any pain, but that's why you're not going to a physiotherapist. Still you should be going to a physiotherapist because the balance management or kind of looking at like how can you walk properly should also be consulted with a physiotherapist. Very good advice, Kinjal. I would say that and I should also talk back to my parents and have them go to a physiotherapist for that matter. So coming to we talked about kids and we talked about older people. Now there's one area generation, one section, right? I mean, who and especially in India, who tends to take their physical health at the back burner. Like tend to take their overall health, but physical health is like the last.
Hmm.
And that's the women in India. Like we've seen our mothers, and I'm sure you must be getting patients who are like, okay, at the last stage of their issue, then they're coming in. So have you seen that one? And what are the basic advices you would give to women in general and women in India, especially, about the physiotherapy?
Physiotherapy for women. Women's are like, I have a lot of work. They stand. They don't even think about their health. They have kids, they have family, but their health comes the last.
Right, right, yeah,
So that's what I get patients. I tell them that it's the time you should think about your health. Keep your health as your priority. Things will be done later. I get a lot of patients as women, they stand like they stand for a constant in a stretch, they stand for 6, 7 hours in the kitchen. Stretch me. And then they get varicose veins. The 45, 50 year females, they're having all those red and purple veins in their legs and they're about to burst.
right,
Cannot even treat those things.
right,
They tell me that I have pain, but I am so helpless that I cannot even touch those veins. They are so delicate now.
right, right.
There
Oh,
are things women should inculcate in a younger age, like the age I am currently 30.
mm-hmm.
So even before that, even I should think about it, how to handle my daily
Right,
activity.
right,
The first thing we should think about is you should think about your health, get some activity, you should complete your household work. I'm not saying women should stop their household work. That is a very good exercise. Not even exercises, if you're just sweeping the floor, if you're doing some household activity, that is an activity, but within that activity you should take a rest. Like, there is a guideline given by American Association. It says that you should have a rest after every 20 to 30 minutes.
oh, okay,
Even a minute rest is more than enough. Like,
uh-huh.
if you're sitting for 30 seconds,
Right,
get up and have a walk for 30 seconds. 30 minutes if you're sitting,
right,
walk for 30 seconds. That
right,
is more than enough to change the position, change the posture.
mm-hmm.
Otherwise, if you're in one constant posture for a longer period of time, your body, your spine, your muscles start getting adapted to that posture.
Okay,
Eventually, they'll become stiff in that position, and you will start getting pain.
right, right,
The basic thing we say to everybody, that change your position, your posture every 20 to 30 minutes.
mm-hmm. Okay.
A minute is more than enough. And then get back to your position again. Like, if I'm standing, I should sit for 30 seconds. Again, come back to work.
Okay, so what you're saying is that the notion that you should not be constant sitting, uh,
Hmm.
is one. But what you're saying is it's not just constant sitting, but even
Sitting.
constant standing is also the same thing. That
Yes.
you should not be standing in a stretch. If take some rest in the middle, take some breaks, and then kind of do that activity. So
Yes.
okay, well, something I'm also learning, because I do the try to follow for my sitting, because of course with these corporate jobs, too much of sitting on the laptop,
Yes.
at
Yes.
the desk and all. So try to do that, but I did not know that even standing is also the same thing that you should be following, that then sit and stand back. Okay, that's a
There
good.
are professions like teaching. In
Yeah,
India, now, there are many schools that don't allow teachers to sit.
right, right,
Like,
yeah,
for 6 hours, if they are teaching, they need to stand for six constant hours. Only and only if they don't have lectures and they're in the staff room, they can sit.
right,
So that's one profession that in females that causes varicose veins.
uh-huh.
If a female comes to me and if she says she's working and she has varicose veins, then the first profession I'll ask that, are you a teacher?
Mhm,
They say, yes, we are a teacher. And that is the profession they give them varicose veins. Or if they're not working, they are standing at home.
mhm, mhm,
Constantly, they are standing at home.
mhm,
So these are the things that a female should take care of. These
right,
are the basic things. Other than that, you should mainly concentrate on core. Aajkal na, the core muscle that we say are very weak for every female. Even males have weak, but females have thoda inclined, they are more weak.
right, okay,
Because they are too stressed. They have mental pressure also, they have physical pressure also, they need to do all the household work, and together with that, they even have to have working. Some female who are working,
right,
they need to handle workplace also, they need to handle house also. So it's
right,
very difficult for the females, and that has led to weakening of the core muscles.
uh-huh,
I had one patient recently. I had one patient, and it's been 3 months she's with me.
uh,
uh, I just for 2 months, I just concentrated on her core, and now she's able to do all her activities.
uh-huh,
She's doing yoga. Along with that, I started her yoga also. And she says that I feel so positive in my life. The negativity, the feeling of not doing anything, that all disappeared when I started my core. And my core, as soon as my core got strengthened, my thinking ability also started improving.
right, okay, yeah, mm-hmm,
All the positivity that is present in me, I started thinking about it and how can I lead my life.
mm-hmm. Oh
So
yeah.
this is one more thing. She didn't had any pain. She just came to me. She wanted to lose weight. So
Hmm.
I said, "Pehle, losing weight is not important. Pehle, maintaining your core and strengthening your core is more important.
Okay, yeah, right.
The basic core muscle, it just takes a minute or two to complete that core muscle exercises in a
Okay.
day.
Hmm. Okay.
People don't even do that.
Yeah, yeah. So, so talking about core muscles and talking about your own, you know, body posture, right? Two areas when and especially speaking from a woman point of view, right? I mean, women are the bearers for a next generation as well, right? So of course they give birth and all that stuff. So is it, how do you like, what do you recommend once after after the childbirth and all? How should the women take, because there are a lot of issues we hear after the childbirth. Their back pain has started, or especially if you've gotten it through surgery, right? So back pain start, and of course you're doing all the activities with the kids, so there are other issues that get started. So how a physiotherapy or a physiotherapist like you can help postpartum, for the ladies?
Postpartum, we do help, but there female should even think about prepartum, like
Oh,
prenatal. Before
okay.
the birth, they should start exercising even before the birth.
Hmm.
As I said, the core muscles are weak.
Right,
Nowadays, all the females have weak core muscles. So they are not even able to have normal delivery because
right,
the muscles are so weak, they cannot even do activities. And sometimes when the doctor says now you have to have a bed rest,
right, right, right. Yeah.
difficult pregnancies. So that also leads to postpartum pressure. There's one common I cannot say disorder, one common condition females are facing after post birth
Mhm.
is that there is an issue in the thumb pain.
Yeah. Okay.
People have started getting this thumb pain. It is known as dequerence.
Okay.
The reason is they don't know how to pick up the child, like when they are feeding, when they are sleeping, how to carry the child. They don't know. They're already weak.
Right.
They had that issue, shoulder wala issue they might be having, and when after postpartum when they lift the baby or improper feeding position, this all leads to thumb pain, which has increased. I do get a lot of cases of thumb pain
Oh, really?
after post delivery,
Okay. Yeah.
and it doesn't go. Even after physio, temporarily they'll feel relief.
Yeah.
Again, they'll lift the baby in that position only.
Mhm.
Again, they'll start getting pain. Until and unless they stop lifting the baby, the pain doesn't disappear.
Yeah.
And once they've stopped lifting the baby, the pain disappears automatically.
Huh. Okay.
Postpartum, they even get back pain.
Right.
Postpartum depression is also one of the most important thing.
Yeah, yeah, of course. Yeah, yeah. I mean, I think we need a more one full episode about the postpartum depression, right?
Yes.
Yeah, but then talking about the physical posture. I mean, this was a news to me that that thumb pain, and it's related to your how you're carrying the child and how you're kind of picking up the baby, or how your posture is, which is something good to know. But so we've talked about prenatal, we've talked about postpartum. Now the women go through a lot of phases in their life, right? So then there's a phase when they are menopausal, right? Now menopausal, again, as you're saying, there's something psychological going on with the women, right? I mean, there can be depression and all, but at the same time, since there are so many hormonal changes going on in the body again needs the support or the physical strength, right? So have you seen cases where how would a menopausal lady or a premenopausal lady take care of her physical health?
In India, now, menopause is not considered as something important. They don't even care about it. But
Right,
they should care because you're going through a very big change in your life. The hormones are like, they are causing a chaos in the body.
right, right,
So, nutrition, first of all, the diet should be very important. Since the hormones have started changing, women start getting deficiencies.
right.
As we do have vitamin D, B12, being a vegetarian, we do have some deficiencies. But along with menopause, some nutrient deficiency also starts getting into the body. The
Uh-huh.
female should go to supplements. If you're not getting supplements, go for the proper diet, proper food
Mhm,
in which you'll get your supplements.
mhm.
Along with that, if you're not going to a physio, it's okay, but do some physical activity so that you won't have mental pressure. You'll be at a mental peace because at that point of time, mental peace is very important. Otherwise, everything feels like it's irritating.
Right, 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 right. Yeah, yeah.
So That's the play of the hormones.
Yeah, yeah. Oh, okay, okay. So what you're saying is that, especially for the menopausal ladies, not just the nutrition, they should take care of their nutritional value, health as well. But then they should be keeping their minds busy. They physically they should
Yes.
be busy. So one, mentally they're stable about like what's going on. Because yes, hormonal changes. I've heard about and I've experienced actually about being, um, anger issues, or having those kind of mood swings, and kind of all other issues as well. So physiotherapy, if not physiotherapy, going to a physiotherapist but taking care of your physical health at that time, they can kind of not just limit the concerns that they have through menopause.
Talk to someone. Whatever you're feeling, just go and talk to someone so that you'll feel, okay, yes, I've dispersed my issues.
Uh-huh, uh-huh.
I have to be discharged. Otherwise, everything gets piled up now. It comes as an anger issue.
Right, 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 right.
Main thing is menopause is psychological. You need to think about how to keep your psychological temper in control.
Uh-huh. Okay. And yes, anything which is within you, right? It by the time it impacts your body only, right? So if you're not taking it out, it will start impacting your body, your physical health. That's where it kinds of impacting. Okay, awesome. So lastly, like I know, you're a busy person. I would not want to take too much of your time, but lastly, as a physiotherapist and in general, what would you advise for people to follow towards being, we talk about mental well-being, we talk a lot about nutritional values and all, but we don't talk about much about physical well-being, right? So I would want to hear from a physiotherapist now how we should in general take care of our physical health.
Okay, according to American Association, like they have mentioned a basic guideline. Like in a week, 5 days, you should go for 30 to 35 minutes of something like walking, jogging, cycling, swimming, anything. This is for your heart health. It will keep your heart healthy.
Uh-huh.
So you should basically do that. Twice a week, you should go for strength training. If you haven't started strength training, it's okay, but at least start with this walking wala thing, walking or jogging. It's very good, and especially in the morning.
Right. Okay.
The aura in the morning is very much different as compared to the aura in the evening
Right,
or
right,
night.
right.
So get up early, not even or not very early, but get up early and do at least 30 minutes of exercises. Give that time to yourself. Think about your body, cleanse your body as much as possible.
Uh-huh.
And then you can do your activities. Yes, you should think about your posture, how you're sitting. If you're on a bike, how you're sitting. If you're in a chair, like sedentary lifestyle, if you know you have sedentary lifestyle, make some changes that will be better for you in your future.
Mm-hmm.
It will help in your future because we want to live life.
Right, right,
Otherwise, will be, you can say, diseased in a very small age. In a very young age, you will be having some issues,
right.
postural. And if you're tired, you know you have done some physical activity for the day. When you're getting home, bathe yourself something in like warm water with salt. This is the most very important thing. Like if you like taking a bath at night, warm water with salt will relax your body, will relax your muscles, and you'll get a very good sleep. Sleep is also important. You should have a sleep of 7 to 8 hours
Mhm.
because we are working for the whole day. We need, our body needs rest so that our body can repair all the things that has happened in the previous day and can be prepared for the next day activity.
Right. Okay.
So the basic, whenever you feel there is pain, go to a doctor, consult a doctor, get a physiotherapist, treat your pain as soon as possible. The earlier the better.
Mhm. Okay. Yeah. Awesome. Oh, that's so the I think very much what all you've kind of suggested, this is very natural and people should be doing it. That unfortunately we try to take our physical health at the back burner, and that's where we don't do it. So thank you so much, Kinjal. I mean, I really appreciate you telling us all and walking us through the different areas and how we should be taking care of our physical health. And you rightly talked about menopausal depression, and maybe one day I'll take do another episode with you about the menopausal depression, because that's something that we do not talk about, and it's kind of a taboo, I think, in our society to talk about menopause or menopausal depression at times. So that's what we should be
No
talking.
one talks about menopause.
Yeah.
basically people don't even talk about period. There are many changes in the menstrual cycle also.
Uh-huh.
How to maintain the menstrual cycle is also important sometimes, but people don't talk about it. It's like a taboo only in India.
Yeah, yeah, and we are seeing puberty hitting early at an early age now,
Ah,
just
it
because
has started.
yeah,
Earlier, it 16, 17 years puberty used to come, but now girls get puberty in 10 years, 11 years, 12 years.
right, and
Lose also that early. Na? The menopause also comes early.
yeah, exactly, yeah, right. So and it's all related to your physical health and your mental
Yes.
health, right?
Actually, it's more related to your stress, your mental health.
Yeah,
Physical, theek hai, we can improve it, but mental health causes a lot of impact on your body.
yeah, right. You're right about it. Okay, awesome. Well, thank you so much, Kinjal. Appreciate your time. Appreciate all the inputs that you've given. I'm sure the whoever is would be listening to this episode would take advantage of the advices that you've given us. But thank you so much for gracing our episode and our podcast channel. And as I said, I would be connecting more about more other topics with you. So thank you so much for your time.
Thank you.
Yeah, bye.
Bye bye.